What to expect from a lung cancer biopsy and its results. A lung cancer biopsy is a key step in understanding what's happening inside your lungs. It involves taking a small sample of lung tissue to see if cancer cells are present. This helps doctors confirm a diagnosis and figure out the best way to treat the condition. There are different types of biopsies used for lung tissue. One common method is the needle biopsy, where a thin needle is guided into the lung through the chest wall. This is usually done with the help of imaging like a CT scan or chest X-ray to locate the abnormal area precisely. The procedure typically lasts between 30 and 60 minutes. You will be given local anesthesia to numb the skin and sometimes a sedative to help you relax. During the biopsy, you might feel a little pressure or a quick sting when the needle is inserted. Afterward, pressure is applied to stop any bleeding, and a bandage is placed over the site. A chest X-ray is often done afterward to check for complications such as a collapsed lung, which is a rare but possible side effect. You may need to stay in the hospital for a few hours for observation, especially if oxygen therapy is needed. Another common approach is the transbronchial biopsy, which is performed during a bronchoscopy. During this procedure, a flexible tube with a camera is inserted through your mouth or nose into your lungs. Small forceps are passed through the tube to collect tissue from the airways or nearby tissue. This method is often used for central lung lesions and is performed under local anesthesia with or without sedation. In some cases, more invasive procedures like thoracoscopic or open lung biopsies are necessary. These are performed under general anesthesia and involve small incisions or open surgery to remove larger tissue samples if other methods do not provide enough information. During the biopsy, you will change into a hospital gown and your vital signs will be monitored. Sedation or local anesthesia will be administered to make the process comfortable. Imaging guides the doctor to the exact location of the abnormal tissue. You may be asked to hold your breath briefly during needle insertion to reduce lung movement. Multiple small samples might be taken to ensure enough tissue is collected for analysis. Afterward, the site will be cleaned and bandaged. Risks are generally low but can include bleeding, infection, and pneumothorax, which is a collapsed lung. If a pneumothorax occurs, a chest tube might be needed to reinflate the lung. Minor bleeding at the biopsy site is common, but serious bleeding is rare. The chance of cancer cells spreading along the needle track is extremely low when the procedure is performed properly. After the biopsy, you will likely rest for several hours and have follow-up chest X-rays to check for any complications. You might experience soreness or mild pain at the biopsy site, which can be managed with over-the-counter pain relief. The tissue samples are sent to a pathology lab where specialists examine them under a microscope. Results usually take from 2 to 10 days. The report will tell if cancer cells are present and may specify the type of lung cancer. Additional tests on the tissue can identify genetic mutations, which can help determine targeted treatment options. If cancer is confirmed, your doctor will order further imaging and tests to determine the stage of the cancer and plan the best treatment approach. It is important to discuss all your concerns and health conditions with your healthcare provider before the procedure. Follow any pre-procedure instructions, such as fasting or medication adjustments. If sedation is used, arrange for someone to accompany you home afterward. Always report any new or worsening symptoms like shortness of breath, chest pain, or bleeding after the biopsy. A lung biopsy provides vital information that guides your diagnosis and treatment plan. While it involves some risks, it is generally a safe procedure that offers valuable insights into your lung health. Remember, always consult your healthcare team for personalized advice tailored to your specific situation.